Hi, my name's Dr. Amir and I'm a GP at the Ridge Medical Practice in Bradford. If you're thinking about a career in general practice and want an idea of what you're letting yourself in for, then our peer-to-peer sessions offer a bit of insight. Each episode features genuine conversations between GPs and other practice colleagues. I gave this one a go with our clinical pharmacist, Iram.
Hi, my name's Riaz and I'm the lead clinical pharmacist at the PCA.
Hi, my name's Dr. Amir. I'm a GP partner here at the Ridge, and I do a few other bits like diabetes and training and education and all that kind of stuff. And that's how I met Iram. I was just minding my own business in clinic, and I had an email from a mutual friend of ours who was a community pharmacist, who said she was working with another community pharmacist who wanted to do their prescribers course, and would I mentor her and support it. And to be fair, I have a background in training GPs, training nurse practitioners and medical students. I'm the education lead here for the practice. But one thing I hadn't done before, which now in hindsight is slightly surprising, and I was very late to the game, is support pharmacists through their prescribing. So I thought, no, this is something we should certainly do. And as a practice, we pride ourselves on our training. We pride ourselves on our multidisciplinary kind of team approach to patient care, because we know, certainly other members of the team have far, really specialist knowledge about certain things more than we GPs do. And it's important that they use that for patient care. And we hadn't utilized that in pharmacists really within our organization. So I was intrigued, I would say. That's what drew me into this. How was it for you, Iram? Yeah, a new challenge, I would say. And I think you realized quite early on that it was new to me, because you were leading me through it, I think, what I had to do and things.
Well, we got through it. I passed in the end, so that's good. So just a bit about my background. I qualified as a pharmacist in 2013. So since then, I worked for one of the larger multiples in community. So I've done a range of roles with them. I've done a bit of store-based work, relief management, a little bit of outpatients as well. And I also did my diploma on the side. It then got to the point where I was looking for a new challenge, and I thought I've reached a bit of a ceiling in community. So I took a career break, did a bit of locuming, and that's how I got to know Amir and did my prescribing here at the Ridge. I then qualified as a prescriber last July and started in the role, a PCN role, a month later.
It was really interesting, I think, because I'm a GP with a special interest in diabetes. So I usually manage our patients who are on injectable therapy, so be it insulin or GLP-1 mimetics or something like that. The diabetic clinics can be quite complex, because these patients often have a history of having had poorly controlled diabetes and having lots of other multiple comorbidities. And where we work here, and I'm sure you'll agree, it's a great place. It's a lovely part of Bradford, but it can be very socially deprived in pockets. And I think a lot of that social deprivation plays a massive role in the health of our community. And I think, I don't know, what did you think, Iram? I guess I've never really asked you this before, but when you first joined those diabetic clinics and saw me with those patients, how was it for you?
I actually really enjoyed it, because I was new to primary care at that point, so everything was new to me. But just sitting in and observing the clinics, I found it really interesting. Obviously, all of your patients love you anyway, so that was nice. It was good fun, but I learned so much. It was just like a sponge in those clinics, and that helped me with my assignments for my prescribing course. And obviously, I was able to pass and get through that.
Yeah, and what's interesting really is, because by the end of it, you were seeing some of the patients off the list, which is always good when you're when you've got a list and someone else is helping you see the patient. So that was really useful. But you took to it so well, and it was great. And what it did at a time where, as an organization, we didn't have clinical pharmacists, is really make us understand your role, because as well as doing those diabetic clinics, you were also doing some of our medication reviews for us as well, which, is a godsend when you're working in a high pressured environment.
Yeah, no, that was something that was new to me. Really interesting. It helped me see things from a more clinical side, which I didn't get the opportunity to do in community. So that was really good. And yeah, now you have a full team of pharmacists, so we're able to take on a lot more work for you and free up more of your time to spend with your patients.
Yeah, I think that was really interesting, because by the time you'd qualified as the prescriber, this role through the primary care networks, which is a collection of our GP practices, in our locality working together on various things. We were able to recruit clinical pharmacists into this kind of new role for us, and because you were so you fit in so well within our team, and the care you provided to our patients was so important. It was really handy that we'd had you here and been able to observe a pharmacist in that role already. And so when it came to employment, it was a no-brainer for us, really. You were the obvious choice amongst the other people we employed as well. So how many do we have now, Iram? Because it feels like we're constantly interviewing and getting more. How many have we got?
Yeah, so we have 2 rounds of interviews, and from January we will have a team of 6. So yeah, really exciting. At the minute we've just had a couple more joiners, so they're in the training process. But yeah, January we'll have a full team of 6 to work across the 5 practices in the PCN. So there'll be a lot more work with care homes, a lot more structured medication reviews, starting our own clinics as well. So a lot of scope for pharmacists.
Yeah, I mean, it's been really beneficial to us as GPs, because and even the nurse practitioners that work with us as well. I think as doctors, we're always used to working alongside pharmacists, because we've had you when we were in hospital. We rely on you to tell us what we've done wrong, really. I always used to dread that tap on the shoulder from the hospital pharmacist going, you've prescribed this wrong. May I suggest this? And they're always so nice about it. And I can imagine really what they're thinking is, God, how did you ever get this far? But yeah, so as doctors, we are definitely used to working alongside pharmacists. And it's such an obvious thing now that you're here, but I can't believe it's taken us so long to get here. But the expertise that you guys provide for us, when we've got that medication query, instead of us kind of asking each other and trying to figure it out ourselves, we can ask an expert, which is you guys, and you have such detailed knowledge of the cost of medication, alternatives to medications that we don't know, what's available, what's having a manufacturing problem, all of those kind of things. You guys are brilliant at digging that out like straight away.
Yeah, and it's quite good that the GPs are able to message us quite quickly or send us a task, can you look into this? Saves them time of obviously doing that. We have a large enough team to be able to do that, as well as a pre-reg as well. It helps with her training before she qualifies as a pharmacist, to look into these queries, find that information, relay that back to yourselves, and it's just a great example of everybody working together, really.
How different is it to your community role?
They're worlds apart. I mean, for one, I was able to work home throughout the COVID period, so that was quite nice. In terms of the actual day-to-day role, I'm looking more in depth into patients' notes, helping them with their clinical issues. In community, I would be you are at the heart of the community, which is nice because you have a lot more face-to-face interaction with the patients. Although in a COVID pandemic, it's obviously not great. But yeah, I mean, there is benefits to both roles. I think it's what you enjoy. And like I said, this was a new challenge for me to be able to develop my clinical skills, do more of the face-to-face clinics, telephone clinics, and just expand my role and delve into care homes. There's so much to do.
Yeah, I think once it starts, it does feel kind of very large, because that's what it's felt like to me, because I'm the GP who supports the clinical pharmacist within our primary care network, and there just seems to be an ever-expanding role for you, which is great, because that is work that would have fallen to GPs otherwise. So the medication reviews, the structured medication reviews, the rationalizing of medication in care homes, audits, projects, all of those things that, I mean, I'll be honest with you, Iram, I just couldn't bear to do. I just couldn't.
No.
So I'm glad you like doing them.
I know.
Yeah, I'm more of a pig-facing kind of person, I think.
But yeah, I mean, it's good because it's new for us as well. So it's nice to be able to obviously learn new skills, and just look more into depth with things, the prescribing trends, look more into shared care drugs between ourselves and the hospitals. At the minute, we're trying to get some policies across the PCN. So I know we have quite a good policy with opioids here at the Ridge, and we're kind of trying to get that across the PCN. Again, things with items that shouldn't necessarily be prescribed on prescription. We are encouraging patients to buy those over the counter now as well. So there is so much for us to do, and I feel like we're only just getting started, really.
Yeah, and I think that's an important point, really. One thing we're trying to do is learn from each other, learn from other practices, what practices do well, what we can offer them. And one of the roles, because you work across a number of practices, it's really interesting to gain that kind of insight that you guys have from going to these places and speaking to their GPs, speaking to their managers, looking at their protocols, and actually saying, well, actually, these guys do this really well. Maybe we should do that here, and vice versa. And you mentioned one particular thing. You mentioned the opioid. We all know that opiates are a kind of a really hot topic at the moment, and we're trying to reduce our prescribing of opiate-based medication, and we have a very strict policy here at the Ridge around that. And other practices are now doing a lot of that. But one of the things we've worked hard on together, I guess, is trying to make it uniform across the PCN. So the way people order prescriptions, the way medication reviews are done, all of that kind of stuff, we want to try and make it standardized. And I think that has really improved the quality of care we can provide to patients as well.
And I think it just helps that, again, with shared best practice, really, across the different practices. And like you say, if one practice does something well, why not share that?
Yeah, and I think that's been really useful. We've also, I think, some of the things that we've done together have been quite entertaining in ways as well. I remember we work clinically really well together, and we, all of that kind of stuff, because we've worked together for a couple of years now. But I've got to say, Iram, even though we're colleagues, I think we're friends as well, because I have been through some rough patches, haven't I, over the last couple of years? And I remember you bought me that book that had a picture of a poodle on it and said, "Haters are going to hate," and it got me through it. And the mug, you got me my mug as well.
Yeah. It's been so nice to work again alongside you, Amir. And obviously, when I started my prescribing, I think GPs behind closed doors had literally just finished. So then see you progress into obviously all these new roles that you have, it's really proud to see you do so well, really. And it's really nice because you do deserve it. And the one thing you haven't actually told me before, Amir, is how you got onto TV in the first place.
Well, it was completely by accident. There's a show on Channel 5, you'll know about it now, but GPs Behind Closed Doors. And it was in its 5th or 6th series, I think 6th series. And they were they'd filmed all the previous series down south in London and Bristol, and were looking for a practice up north. And as with most Southerners, they think up north is a big kind of conglomerate area that they just refer to. And so they'd been to practices in Manchester, Liverpool and Newcastle, and ours was the last practice that they were coming to visit before they kind of settled on one. And I think we won them over with Debbie's lemon cake. Debbie is one of our nurse practitioners. She makes the best cake, doesn't she? And that kind of won them over. And then they started filming GPs Behind Closed Doors, and it went on telly, and it was it was really popular. And I was really lucky because I had some really interesting patients on the show, and I think people responded to them really well, which meant they responded to me very well. And then kind of one thing led to another, and I did other bits of television and writing. I've written a book.
Now you have a book out, which is amazing because I've finished reading it now as well. So
you finally finished reading it. What did you think?
It was amazing. Like, I can't wait for the second one. And yeah, I'm really I did my little signed copy as well, so that's going pride of place.
by the toilet. I went to my mum's house and it was by the toilet in her house. I was very disappointed. Yeah. But yeah, no, so that's it. So I'm balancing, general practice with all of that kind of thing. I love both sides of it now. Like I say, it was completely by accident, but it's a lovely thing happened, and I know I'm really lucky. So I'll just ride it until the wheels come off, really, I think. But I think what's important, really, and something that people don't realize is if and when you get the right practice to work in, and I say this to my GP trainees all the time, it's about working in the right practice. And that as soon as you go into a practice, you can feel the vibe of it. And it's really daunting coming, I remember that first day when I came from hospital into general practice, and you kind of say hello to everyone and you're really excited, and then all of a sudden you're in a room on your own and the door's closed and you go, wait a minute, this is new to me. But what's nice about this practice and a lot of practices up and down the country is the fact that you might be in a room with your patients on your own, but there's someone either side of you doing the same thing, and you can knock on the door there. There's a brilliant reception team that you can go in there, and if there's any kind of thing that they can help with, they will definitely help. And it's the same, with the nurse practitioners, the practice nurses, the healthcare assistants. Even though it might feel for a minute that you're on your own, you're really not, because you're surrounded by all these experts like yourself, that have knowledge of things that we don't have knowledge on, and can really help. And primary care is moving in a direction now, particularly with primary care networks, where we're seeing people that colleagues that may have otherwise worked in hospital, physiotherapists, pharmacists like yourself, in primary care, really providing not just support to us, but far better patient care, because it's far more holistic and patients are seeing the right people rather than just the GP for everything. And I think you're a key role in that.
Especially with the SDAT clinics, so the same day assessment clinics. Pre-COVID, there was the real, I know you used to have the coffee breaks on a morning, but I think that really helped as well to feel part of that team, to have those morning coffees, and everybody would debrief, and it would just break up the morning, but you do feel part of a team, and that was really nice. And hopefully after COVID we could get back to some of that.
Yeah, I love those coffee mornings because you kind of solve all your life's problems, don't you, in those coffee mornings? I remember people told me which house to buy, why I shouldn't look at certain houses. Those coffee mornings got me through most of my life, to be fair.
So much.
And I think that's what's key, isn't it, in general practice, because there's no shying away from the fact that it is a tough, high pressure job. You're seeing patients in really high numbers, and you've got lots of paperwork to do and all of that kind of stuff. And because I train GPs, and I've been training GPs for over 10 years now. That's when you're supposed to say, Iram, no, you don't look it. Go on.
Well done.
Thanks.
A bit delayed.
Thank you. Yeah, a bit late. I'll allow it. But one of the things a GP trainee said to me one time, actually, which I think has stuck with me, and I've kind of made sure to keep going, is, they say, and also, this, Iram, inner city Bradford, beautiful place, wonderful place, where I've grown up, and you've not grown up too far away from here. But it is a challenging population. There's no doubt about it. There's lots of people who don't speak English, lots of people with health expectations which are unusual, and the social deprivation we've touched on already. So it does prove to be a challenging population, particularly if you're a GP trainee, and it's reflective of inner city areas across the country. But what this trainee said to me was, as they left really on their last day, was, the job is really tough and the patients here are very challenging, but it's the team that keeps you going. And I don't know, you're new to that. I've been at this practice now for, well over 10 years. But you tell me, how have you found the team?
Well, when I was in your clinics for my prescribing, straight away you can definitely tell it's a real good team, and it's more like a family environment, to be honest. And you just feel so welcomed, and everybody's so friendly, everyone's so supportive. Even when we were having the SDAT clinics, there'd be times where somebody would say, oh, I'll just see your next patient, or would you mind just seeing this patient for me? And there's a bit of give and take on everywhere, and it's a real supportive environment, and you can see that through the emails that the colleagues send around as well, praising staff, or just saying thanks, really. It is more of a family thing.
But we've tried really hard, and it's not a case of trying hard, really. It's come naturally, though. But you mentioned, we've connected with each other. We still have our team meetings remotely. We still send, when anyone's bought cakes in, there's always emails going around, cakes in reception or that kind of thing. That's the best thing about the pandemic. One thing we haven't stopped is making cakes and bringing in sweets and chocolates. So I think that's kept us.
One thing as well that I really enjoyed was last year's Christmas period. That was so fun.
So yeah, we're not all stuffy, boring GPs, I think is the message here.
Definitely
we are, and I think that for me, even though I've been here for a while, some of the GP partners have been here for 20 plus years, and it's I think they lead by example. That not only are they so approachable and so nice, and I learn so much from them. They're brilliant, aren't they? I mean, it's easy for me to say. I guess it's better if you tell us your perspective on that.
Yeah, I think definitely coming in, you can see the dynamics in the team, and you can see how approachable everybody is. There's no real hierarchy among the GP partners, which I think is really nice, and everyone just respects each other's role. And I feel like everybody is experts in their own field. I mean, you're the diabetic specialist. We have dermatology experts, cardiology, women's health, MSK. There's a range, epilepsy, neurology. They all are experts in their own field, and I feel like you can approach any of them if you did have a question, and vice versa as well. Yeah, I feel like hopefully everybody can ask us questions they might have as well.
Yeah, we certainly do ask you guys when we need to, but I think that's important. It highlights kind of the scope of what can happen within general practice. We've talked about the different members of the team and their expertise, but also within GP, being a GP, it's not just a case of regular clinics. There's so much scope to develop specialist interest depending on what your background is, what you've done up to that point, or where you want to go, really. So with me, it's education, training, diabetes, and minor surgery. But you've highlighted some of the other things our GP, not just GPs really, our nurse practitioners do as well. They have specialist interest in child health, neurology, travel health. There's so much scope, and there isn't really a speciality that you can't develop if you're in general practice. And I think for me, that's what's really lovely about it. And that's what's lovely about working in a practice like this, and lots of other practices are, I guess. But you're our lead clinical pharmacist, and that means that you've got a lot of responsibility. So tell us about your responsibilities as the lead clinical pharmacist.
So a year ago, 3 of us started as the pharmacist team. The plan was for us to do face-to-face clinics and get more involved seeing patients, but then obviously COVID happened and we had to put that on a back burner. Since then, we've recruited more pharmacists. We now have a team of 5-6, and the plan is to start up some clinics and get more involved with seeing patients. We are all on the GP pathway, which is a training pathway for pharmacists in primary care. And the plan for that after it would be maybe to think about being an advanced practitioner as well. And then you could be more involved with the same day assessment clinics and seeing patients, and seeing patients that might not necessarily need to see a GP and could be dealt with by a pharmacist as well, and again just free up your time.
Yeah, I think that's really key for us. Over time, we definitely want to see our pharmacists develop, and a clinical pharmacist turning into an advanced practitioner seems like the natural course of progression. And with expanding roles within primary care, roles within nursing homes, roles in home visiting, all of this kind of stuff, we have got to open it out. You've got to embrace these new roles that are coming through, because the whole idea of the old-fashioned GP sitting in a room, seeing everything, doing everything is just so archaic, and it doesn't lend itself to modern day general practice. And I know my life has got a million times easier since you guys came on, since the PAs have been here, since the nurse practitioners have been here. It is such an amazing thing to be part of. And one of the things, all those really complex things that come to us sometimes that feel complex to us as GPs, those really unusual drugs that someone with maybe cystic fibrosis is on, or and you kind of go, God, I've never prescribed this before. I need some more information from it. Having you guys in the same building and just firing off an email or picking up the phone or just coming in to see you and saying, should I really prescribe this? Does this sound right to you? And knowing you're having experts is just so useful for us.
And I think we do feel part of it well. And, although we are based at this practice, we work across 5 practices. And we do visit them as well. We might take a morning and spend some time working from another practice. And doctors there, again, they do pop their head round with any queries or questions. And you do feel part of a wider team, and it does make such a big difference to your own role as well, because there's so many people to learn off as well.
And as your roles expand, because all of those things will need support from a GP, I guess, through the advanced practitioner course, through the prescribing, we also learn as well and benefit from having you guys around. Because I know when you were in my diabetic clinic, I just turned to you and go, Iram, what is the side effect of this drug? I can't remember anymore. My brain is frazzled. So that was, it's really useful to have you guys in the building. Honestly, it's so useful. So thank you from me, definitely.
Well, thank you for our new office. It's really nice.
You're welcome.